Welcome to 21st Century Health. I'm Jackie Bales. Unlike the medical field, the mental health and addiction treatment industry lacks standardization on multiple levels. For many providers, patient information has been captured on paper or a combination of paper and other systems, making access to clinical information problematic at best. In addition, the lack of standardization further complicates the submission of claims and billings in an already difficult field. What these providers need is an electronic solution, similar to what their medical counterparts already enjoy, but one that's tailored to this fluid and relatively fragmented industry. That's where Sigmund software comes in. Joining me today to discuss their software as a service solution is Sigmund's president and CEO, Philip Turner. Welcome, Philip.
Thanks, Jackie. Great to be here.
You know, Philip, from an outsider's perspective, one wouldn't think there'd be that much difference between the software needs of these industries versus the medical field, but evidently that's not the case. Tell us more about the challenges these providers face.
The main challenge would be the lack of standardization across the board, from documentation to treatment outcomes to workflow to billing. There's a lot of complexities that come with treating someone with mental health disorder. And it's not just from a treatment perspective that you have to be concerned. Providers also struggle with authorizations and claim reimbursements. And this can be a challenge because the claim reimbursement process comes from really the medical side, where the commercial payers are expecting more tangible results on both the diagnosis side and on the treatment side. And so the end result is that you get much lower reimbursement rates, typically in the behavioral health side, because it's so non-routine. And in addition to that, you're really seeing a situation where they have a lack of real-time information. That's another really big challenge for them, because while they may even have an electronic system in place already, which means they have less paperwork, there is this situation where they have typically a combination of paper and electronic information that they're trying to pull together, and the end result is they have a lack of real-time information.
I'm sure. You know, I think it'd be difficult to work in this industry and see the medical field benefit from a comprehensive electronic solution, but yet not have access to this same technology. What is Sigmund software doing to change this?
Well, over the years, what we've really honed in on is this lack of standardization. And really what we've been doing is we've been focusing mainly on treatment and billing to make it as standardized as possible. And we've been very fortunate to work with some great customers over the years, some very engaged customers that have worked with us on making our products even more catered to the industry. And in addition, the real-time information is there. We have almost 500 reports, and at least 50 of these reports provide real-time information that clinicians have access to, and psychologists and psychiatrists have access to at their fingertips.
Right. Philip, could you briefly describe your software solution for us?
Yes, we provide a comprehensive end-to-end EMR, electronic medical record software solution, and it covers from intake to admissions to bed charting to clinical progress notes to compliance, all of the compliance issues that we have to deal with every day. And it also includes billing, very extensive billing module, and it includes a very extensive reporting module, which includes up to 500 reports that we include in our package.
So this is really for a facility or for an individual doctor's office then?
Yes, all of the above. It really, we have our full solution, which is catered anywhere from 10 users to 2,000 users, and we also provide a solution that is targeted on the 1 to 10 solo practitioner market. But the commonality with all the solutions we provide is that the information is typically available real time, and while the clinician is providing the patient interaction.
Very important. What about the importance of the cloud in your industry? And do you feel the industry is moving that direction?
The industry has been moving very fast in this direction over the last year or two. As an example, last year 85% of our sales were on the cloud side. 15% were client server. Now, if we go back 3 years ago, the ratio was flipped. So we probably were doing 85% on the client server side, 15% cloud. Now, one of the key drivers for this would be HIPAA. HIPAA is the Health Insurance Portability and Accountability Act. It was brought in '96 under Clinton. In 2003, there were security and privacy provisions added to HIPAA. Since 2003, these privacy and security provisions have been strengthened. You're now in a situation where providers can be fined up to $50,000 for every situation where they've put patient data, patient health data in jeopardy. So if you have a situation, for example, in a doctor's office or a psychologist's office where a laptop gets stolen and it has patient information on it, these providers are now exposed to these heavy fines. If they go to the cloud, the data never resides on the hardware. The data is up in the cloud. It's fully secure. It's encrypted, and so really, it gives them peace of mind that they don't have to worry about that aspect.
That is fascinating. Some people would think, oh, it's much scarier to have the information on the cloud, but you're saying the opposite.
It's the opposite, and the other advantage really is that in terms of our providers, they need less IT resources to really manage all of the systems because we're handling that in the cloud.
Fascinating. What about tablet and mobile technologies? How are they being implemented in behavioral health?
Well, tablet and mobile has been slower in terms of adoption when you compare it to primary care. The primary care environment, you are seeing mobile and tablet all over the place now. But behavioral health are definitely not far behind. And I just wanted to show you, this is the unit that we sell today that we install our software on. This is the Panasonic ToughPad. And our software runs on an iPad, regular iPad, but we distribute this device primarily because it's so durable. It's a device that you can disinfect this device.
Really?
You can drop it in a bucket of water and it will still survive. You can drop it from 6 feet, and so it's really built for the clinician environment, especially the inpatient hospitals. And so we've had a lot of success with this unit. Some customers still stick with their iPads, and that's fine. But once you've used this, you won't go back. So we found that this is very good. And in addition to that, this is a very good way of treating a patient. It's much more patient-friendly because you have a situation where if you don't have a tablet with you, but you have an electronic record system, you're going to be accessing the information on the computer. So what it means is that the clinician, the psychologist, the psychiatrist will be turning their back to you constantly during the session.
Oh, that would be awful.
So they're not maintaining eye contact with you. With this unit, they're able to maintain that eye contact, have a really good interaction with you, look down, glance at the notes they need to look at, whether it's medication related, whether it's the previous notes history on previous sessions. They'll have access to it, and they can show you images as they go through. They can show you what they're looking at. Images, show you, and it's very, very friendly, and people are very used to seeing these tablets now. So
that's a great idea. Tell me what the High Tech Act is. I haven't heard of that. How does it impact your market?
Well, the High Tech Act is the Health Information Technology Act, and it was brought in 2009 under Obama. And what it is, it's a $25.9 billion incentive program to improve the health information infrastructure in the US. And what it is there are incentives through Medicare and Medicaid. The incentives run anywhere from $44,000 to $63,750 per provider over a 5 or 6 year period, depending on the program. And it's really an incentive for providers not only to move to electronic records, but also to use the records in a meaningful way. So it's not just enough for someone to move to an electronic system. They have to prove that they're actually using it for e-prescribing, for example. And if a patient has an allergy, we need to be able to check to make sure when you're prescribing a drug right this second, we want to make sure that it doesn't conflict with any medications that the patient would be taking from an allergic perspective. And it keeps track of all the demographics.
Wow. So let me ask you this. What should providers be focusing on then when it comes to purchasing a software system?
There are several things that you need to be thinking about. First and foremost is you have to be comfortable with the vendor that you're choosing, because this isn't a short-term relationship. This is a long-term relationship that you're building. So you need to make sure you have a rapport with the vendor that you're selecting. That's the first thing. Also, you need to make sure that the software itself is easy to use and intuitive, because you want to make sure that you get widespread adoption throughout your organization. You're not going to get that if it's not easy to use. You also want to make sure in terms of implementation, they have a solid implementation process, because that's where a lot of companies get kind of caught up. Implementation can be complicated with these systems. You need a lot of structure around that. You also need to make sure it's scalable. If your organization is growing in leaps and bounds, and we've got customers that have grown by 2 and 3 times over the years, you want to make sure your vendor can continue providing you the service level that you need. You also need to make sure their support desk answers the phone and answers emails, because that is important. This is a long-term investment.
Right.
You don't want to be left in the lurch, because this system becomes your lifeblood.
Oh, so true. Do you believe, Philip, that primary care and mental health care are coming together in a way?
I do believe that, and it's very good. I've seen some really good things over the last couple of years, and really, there is a driver for this. The National Institute for Mental Health did a study in 2008 that showed that as many as 1 in 4 Americans have a diagnosable mental health disorder.
Wow.
Now that includes addictions, but that's a
That's
lot of people.
huge.
It's 57 million.
Oh my gosh.
57 million people potentially is the pool. Now there is a big treatment gap, though, between that number of people and the number of people that actually get diagnosed, properly diagnosed. And so we're finding that primary care is now becoming part of the solution to that. And so you have a situation where primary care doctors are making links in with psychologists and psychiatrists now to improve their assessments. They're actually inviting psychologists and counselors in to work in their offices on a part-time basis so that they can provide better care to their patients.
Very cool. Very interesting. Let's get back to your software package for a moment. Tell me about workflow and how important workflow is when a facility or a doctor's office is selecting a software package.
Workflow is one of the most important aspects of the software system. You want to make sure that the workflow is very strong. But first and foremost, what you want to make sure is that the software is not going to dictate your workflow. If you as an organization have your workflow defined, the software should come in and help you with that existing workflow. But if you don't want to change your workflow, the software shouldn't force you into changing it. Now, that being said, what we find with clients is that clients come to us and say they want to use this implementation of the new software as an opportunity to review their workflow. And we work with customers in that regard because we have worked with lots and lots of customers over the years. We know the best practices. We can give them some ideas that we've seen and really work with them in defining what their best workflow is. Once they've defined that, we come in and configure the software so that it works best for them.
Do you find many customers just having trouble with or struggling to use traditional EMR type software?
In terms of the traditional EMR, if the workflow engine is not there, what can end up happening is, because it's so big and complex and you've got so many screens in the software package, there could be 200 or 300 screens in any one package. If someone's just starting to use the software package, it can be very, very arduous to navigate through the different screens. So that's where, again, workflow comes in. You want to make sure that if, for example, a psychiatrist needs to simply go in and approve a med that a clinician has recommended, he can just go into his home screen. He can see that that med approval is waiting for him. He signs off, it's done, rather than going into the system to try to figure out, what the psychiatrist needs to do, because time is so limited here. You need to make sure that it's very efficient.
Yeah, that's for sure. What is the Sigmund difference?
Well, the Sigmund difference really there's a few ways we differentiate ourselves out there. The first is that the system itself, the core system, was created by psychologists, and so really what that means is that it's not just about converting paper records to electronic records. It's really about focusing in on the treatment And that's what we've done here. We've created some great effective treatment planning processes, and in conjunction with that, we've brought in some clinical data analytics that are perfect when you're treating a patient. So if you're treating someone, for example, with bipolar disorder, and you switch a drug, for example, we have some analytics that show over time whether that change has been effective or ineffective in terms of treatment. And if it was ineffective, our system figures out some recommended alternatives to that treatment. So there's some really neat things with respect to the data analytics from a clinical perspective. In addition, it's easy to use. I mean, this is why customers love our system so much. You can pick it up. It is complicated, but because the workflow is so intuitive, people can pick it up and start using it. And the last thing would be the people. The people that we have are mostly, the majority of the people are from a behavioral health background. You've got psychologists, you've got billers, you've got administrators, you've got clinicians. This means that we understand the industry, and we're able to work with our customers on making our products better each and every day.
You know, I've heard that electronic health records are very complex to implement. How do you work with the clients to ensure the most successful implementation from the start?
Well, it's interesting, Jackie. We start from the very first phone call. And when I say the very first phone call, that is a salesperson talking to the customer about potentially signing up with Sigmund. The very first phone call, we start setting expectations for implementation, because we are talking about a complicated system. If it's not implemented correctly, you can have a problem. So what we do is we assign a project manager to each of our client implementations. Project manager goes through, provides or details a full project plan, including what we need to do on the Sigmund side, and also some of the information that needs to be supplied on the client side. And we keep track of that. We keep the process moving. Once we have figured out the project plan working hand in hand with the client, then we start talking about the on-site implementation. And there what we do is we use very experienced consultants that come on-site with the customer, work very closely with the customer to make sure that we're implementing the system correctly, because the most expensive system that you can have is a system you never use.
Boy, isn't that the truth. Do you offer an all-inclusive solution, or can customers get an a la carte option maybe?
Well, we offer, of course, the all-inclusive comprehensive solution, but we also offer modules like the call center module and the clinician progress module, and we also offer a billing module. What we typically find is most customers, because of the High-Tech Act and the incentives that are in place, they will tend to go for the all-in-one solution. Also, it's a very integrated, comprehensive system. They really like that aspect. But there are customers out there that start with a module. They might start with the call center module just to get their feet wet, because they've never had an electronic system before. They've been on paper, 100% paper. They start with that, and then they inevitably will move on and implement another module, or more commonly just roll out the full solution because they're comfortable at that point.
Yeah, that makes a lot of sense. You know, you referred to it a little earlier. System support is extremely important. Tell us about your approach to support and how you're interacting with customers over the long term.
Yes, support is very critical. I've led a number of software companies over the last 20 years, and in every case, support has been really a big focus for me. Support is critical. You're investing a lot of money in these systems. You need to make sure that when you have a problem, and problems do happen, it's not whether a problem is going to happen, it's how a company handles it when a problem occurs. So what you need to do is you need to make sure you have a 7/24 help desk, which we do. You need to make sure that you're picking up the phone, talking to your clients. We do follow up with clients even when they're not calling us, to make sure the system's running well. And most of the issues we see, it's not that the system isn't necessarily working, it's configuration and training as they bring on new staff. So maybe they implemented the system a couple of years ago. Now you've got some turnover where you have some new staff members coming on board. They need a helping hand in terms of how to use the system. We're there to provide that. And I think that because this system, it's such an integrated system affecting the treatment, affecting the billing, end to end, it becomes the lifeblood of your organization. If you don't have that support in place, you've got a problem. So I would encourage anyone that's out there looking at software packages, make sure you do the reference checks. And we have that. We have customers that actually fly to other customer locations. They spend money to make sure that they're going to be happy with the Sigmund solution they do. And
so they go somewhere and look at someone's system up and running and how they like it.
Yeah, we encourage them to do that, and it might cost them a little bit of money in terms of the flight. It's up to them whether they do it, but they come back and they're so happy because they're no longer concerned about the implementation. They see how well it's gone. They have a chance to answer or have some questions answered, and yeah, so it's been really positive.
Tell us about the future of Sigmund, Philip, and any exciting technology that might be on the horizon for you.
Well, in terms of the future at Sigmund, of course, our flagship product we keep building onto, and one of the things we're doing right now is we're doing an integration with Salesforce that we're pretty excited about, that is going to make the admission process even better than it is today, so that customers can use Salesforce and Sigmund hand in hand. And in addition to that, we're in the process of rolling out a new product called Sig Solo, which is focused on the 1 to 10 solo practitioner market. So it's kind of like a light version of Sigmund, focused in on that 1 to 10, and we're really excited because that Sig Solo product is perfect in a primary care environment that wants to increase the number of links with the mental health side, as I was alluding to earlier. So really excited about the next couple of years.
Very interesting. Well, it sounds like Sigmund Software is bringing order and peace of mind to an industry that really has been needing such solutions. Thank you for telling us about this today, Philip.
Thanks for having me, Jackie.
And thank you for watching. For 21st Century Health, I'm Jackie Bales.